Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes is common. Approximately 37.3 million people in the United States have diabetes, which is about 11% of the population. About 537 million adults across the world have diabetes. Experts predict this number will rise to 643 million by 2030 and 783 million by 2045. 4 types of diabetes. 1. Type 1 diabetes. 2. Type 2 diabetes. 3. Prediabetes. 4. Gestational diabetes. Now I explain all types of diabetes, first of all type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults. Type 2 diabetes. With this type, your body doesn't make enough insulin and/or your body's cells don't respond normally to the insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Prediabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Gestational diabetes. This type develops in some people during pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you're at a higher risk of developing type 2 diabetes later in life. Symptoms and causes. 1. Increased thirst, polydipsia and dry mouth. 2. Frequent urination. 3. Fatigue. 4. Blurred vision. 5. Unexplained weight loss. 6. Numbness or tingling in your hands or feet. 7. Slow healing sores or cuts. 8. Frequent skin and/or vaginal yeast infections. Diagnosis and tests. 1. Fasting blood glucose test. 2. Random blood glucose test. 3. A1C. What is cure? There's no cure yet, but our scientists are working on a groundbreaking weight management study to help people put their type 2 diabetes into remission. Remission is when blood glucose, or blood sugar, levels are in a normal range again. This doesn't mean diabetes has gone for good.